Namaskar, I am Ashok Vyas, and today I have the pleasure of welcoming someone who has taken care of hearts of people as cardiologist, and he has groomed many of his students to learn how to take care of hearts. Associate professor with University of Pennsylvania, and he has taught clinical medicine, but more than that, he has also been active on the social front with his compassion. In addition to being a cardiologist, he also knows how the business environment functions. He did his MBA also, but today what brings him to ITV studio is related to Wheels Global Foundation. What it is, we will talk about that, but let me have the pleasure of welcoming you, Dr. Raj Shah. Namaste.
Namaste, Ashok.
Let's begin with your role as a cardiologist, and you bring so much smile. So what is the most satisfying aspect of being able to help people take care of their heart?
Being a physician, helping people is kind of a second nature. It gives you the greatest satisfaction when you take a sick person and make them feel better. We are not always able to cure the disease, but at least we can always make them feel better, bring a smile on their face, and that is the most gratifying thing, starting just from the medical school onward. But in addition to that, able to use your learning to help a lot of people who needs care. And when we are able to do that, that is the most gratifying thing I find after so many years of practice and getting satisfaction from taking care of individual patient. Now we are embarking on taking care of lots of people in a way of using technology.
Talking about technology and the way the world has changed in terms of the lifestyle that we have, habit patterns have changed. So now that you have been teaching your students for several decades, I think
5 decades.
5 decades, man. So is there any change that you think, even the same subject of cardiology, with the advanced technology, there are certain additional dimensions which you were probably not touching earlier, but with digital technology being there, and of course social media and whatnot have changed the way you see people have less of habits of going out, etc. So any difference in that front?
Great difference. Even just when I was going through training at University of Pennsylvania from 1970 to 75, 5 years, what we had then, almost 50 years ago, versus what we have today is a world of difference. Our ability to diagnose and treat patients has tremendously changed. For example, we can now look at the beating heart using ultrasound echocardiography. We can use nuclear medicine. We can use, of course, we did cardiac catheterization 50 years ago, but our ability with digital system to measure coronary flows, use the catheter to dilate and open up the artery and put the stent in it, and do electrophysiology. I'm just talking about cardiology. Our ability to see the whole body with the CT scanners, MRI, and with the biotechnology, our ability, we have invented drugs, our ability to make vaccine using the molecule, all this thing as a result of digital transformation, which has given us all these tools that we can use to help people. However, people lifestyle hasn't improved for better. If anything, with all these conveniences and this, we are less physically active. We are not out in the nature. Our habits have changed. we are consuming a lot of processed foods, and that has adverse effect on our health. So on one hand, we are improving our ability to diagnose and treat, but on the other hand, people with their behavior are not really making it easier for us. It's getting worse.
Absolutely. Dr. Shah, you bring the reference of processed food, and I think most of us are now used to having processed food as a part of regular, maybe you get up in the morning and the biscuit that you are having, that is also processed food. And many of these packed foods that come, they are also processed. So why there is adverse effect on health from the processed food?
The processed food, as they are processed, goes through so many chemical reactions. The chemicals added, the trace elements that remains, all this when it goes in your body may have a cumulative effect. Of course, for vegetarian people, it's not as much as with the non-veg. If you look at the processed meat, it has almost 99 cancer-causing elements present as it goes through the processing till it comes on the table. So processing adds so many chemicals and the reaction that is harmful.
So if I summarize what I hear from you is that for our comfort or for convenience, we are actually doing it at the cost of our health.
Absolutely.
So let us connect with the earlier days when village life was the way to live, especially in India. And we go to India with you, as you are going to be there in November 11th to 13th at Varanasi. There is 7th Ideal Village Conference on Sustainable Growth through Rural Transformation. So let me hear from you how much contrast it is for you to go from America and look at the rural situation as far as heart is concerned.
Rural areas in India, in last decade, there has been a tremendous progress in transforming it. But there's so much work needs to be done. I come from village. When I was growing up, Mehsana, my birthplace was a small city. And my parents come from Katosan, which is a population of less than 1,000. Things have not changed very much, and there's so much work that needs to be done. So I grew up in that area. So and when I go there, yes, there has been changes, but there's that lot need to be done. This Ideal Village conference that we are having in Varanasi, it is organized in cooperation with Wills Global Foundation, with Stanford University. Stanford University has run Ideal Village Conference for past 7 years. Johns Hopkins University. Johns Hopkins has a presence for prevention of infectious diseases in Pune and many other places, which is a combined program. So with them, and we are holding it at BHU, because Wills Global was founded by a Penn IIT alumni. You know, IIT graduates, they are one of the most intelligent and successful entrepreneurs in the world. Almost 30% of the world's biggest corporations are managed by IIT graduates. And with their knowledge and with their technology, it was inspired by President Kalam in 2006 that, look, you have been educated in India. IIT, Indian Institute of Technology, was highly financed by government of India, so the taxpayers of India. And likewise, government medical schools. They were heavily financed by government. For example, my entire medical college fees were of 7 years were less than 1,000 rupees. Mm-hmm. In today's time, it's less than $10.
Yeah.
Education wasn't cheap, but it was financed. So all the success that came from education, which were heavily financed by government, I think, and also being our Janmabhoomi, we owe something. We need to give back something. Of course, this is our karma bhumi here, as Modi ji had very rightly said during his first lecture at Madison Hall, that look, this is your karma bhumi. You made it here. You owe to this country.
Okay, so
but also, that's your Janma bhumi,
Yes.
and because this success came, we owe it to there. So with that mission, this was started, and we call it WILS. It's a WILS, but it's not really a will. It is an acronym.
Let me relate to the acronym WHEELS as it is used here. It is water, health, sustainability, livelihood, energy, education,
Right.
all that. So so WHEELS Global Foundation, and you are a chairman for the Health Council, which is H in this, and you also have a mental health program with the director Ishan Shivanandji, who is also known in his own right to be empowering people with spiritual insight. But let's go back to the purpose that this conference, which is happening at Varanasi in November. So as a layman, as an outsider, people who would be presenting papers is one question, and if there are professors going from America presenting papers, it feels that there might be disconnect in terms of the ground realities and the kind of lifestyle that people in rural area have, their set of situation, limitation, etc. So how this becomes practically useful?
Very good point, Ashok ji. The purpose of this conference is precisely to bring all the stakeholders, not just who are in America, but this conference is going to have thought leaders and the leaders who actually have worked in villages, these are the leaders with their NGOs, non-government organization. These are the leaders who are at the policy level in government, who will be brought on a platform in all different areas that they have worked to collectively come up with what things worked, what were the challenges, what was the best practice, how we can solve the problems that we have for rural transformation, for sustained growth. The growth is going to come from rural transformation. If Modi ji's promise to take our economy from 2.5 trillion to 5 trillion in next few years, 70% of people live in rural area. We have 600,000 villages, and their transformation is going to be the driving force for taking us to that level of economic development. We have to improve their living. We have to create the entrepreneurship. We have to create the jobs for them. We have to create give them the power so that they become the engine for the growth. So this conference, they're not just Americans. These are all the peoples like WILS Global. All our projects have been done in villages, and we partner with the local NGOs who are on the ground. The people who will be bringing their thoughts, not just the lectures. We have carefully chosen those people who not going to just tell us or give advice, but those who have actually done the work, proven their track, have something to share with us, bring their experience, what has worked and what has not. So on that common platform, when everybody is there together, I think we can make a statement, and we can bring it to to all the people who will be attending, listening to us, including the policymakers in government. Prime Minister, we hope, will be inaugurating it online. Yogi Ji, the Chief Minister, will be there in person because this is in Uttar Pradesh. And we have policymakers, we have thought leaders, we have NGO leaders from India and from here who have worked in India. So we are not going to take American lifestyle or this. We are actually going to leave.
I'm really happy and excited about this initiative, and you have been a part of it. And this is 7th conference. So I don't know how many years have you been going to attend this, and if you look at the changes, tangible difference that is brought about by some of the suggestions or the heart centers that are being run by Wheels Global Foundation, any story from the real life as it is affected by Wheels Global Foundation?
Absolutely. Just in last year, I'm a physician. I'm not an IIT graduate, although technology is my passion. And I actually enrolled myself into electrical engineering after my first year in college, and I also had admission in IIT Powai, which is in 1963, but I chose to go in medicine, but technology lives in my heart.
And your association with IIT is proven.
And because I was the first in America in 2012 to have a freestanding telemedicine clinic in 2 Walmart stores we deployed as pilot clinic in 2012. And because I have been working it for last 30 years, how to bring technology for delivering healthcare to people remotely. Because I realized that many times patients can't come to the doctors or doctors cannot go to the patient. And of course, in America, it was a hard sell first few years because there was no reimbursement for remote care till come COVID epidemic. And same thing all over the world where patients can't travel, doctors cannot go there. How do you deliver the care? And that's when telecare became reality. And I was invited to give webinar by Penn IIT in 2019. And when they saw my interest and understanding of technology, they invited me to be the member of the board. I became, and I created the Healthcare Council. I chair, and I created the program. Now you ask me about what has happened. Unfortunately that we had COVID epidemic, but fortunately during that time, we received generous donation from people in America mainly and some in India. This helped us to create a telemedicine center. Now let me explain to you how this thing worked. We know that to have that villager to receive care, the first step is it has to connect with the doctor at the other end. Doctors are not there in the villages. We know that out of 600,000 villages, there are only 80,000 health centers. So for every almost 6 or 7 villages, there is one center. 30% of them don't have a healthcare provider. So how are they going to get the care? The best alternative is to bring doctor remotely from a city or where they are and have them come and see the patient online.
I'm actually very excited about, number one, your farsightedness, and you were pioneer in conceiving telemedicine, and you did offer it, and it was before its time, looks like. But you know how it is going to be effective. People have their apprehension, and especially when you talk about it from Indian setting, then until unless you are in person in the presence of a doctor, and many times they say that if you just meet doctor, you feel better. So telemedicine takes away that element.
Yes.
But in terms of your ability to get right information, right medicine, the diagnosis sometimes may have a degree of difference, I would say. But I want to ask you, in rural India, is telemedicine being practiced? Is it functional? And do you, as you have either established some heart centers, and so there might be someone who is not even he's a physician, but someone who knows technology and he can connect with the doctor, because many village folks may not even know how to communicate for telemedicine.
Right. So let me first clarify first point. Your ability to accurately diagnose. During the 2 years freestanding telemedicine that we deployed it is a walk-in Walmart store, just like a quick clinic, but there was no doctor. We brought doctor remotely in this. We saw more than 1,000 patients, and we presented this data for the accuracy, ease of use, convenience, and ability to diagnose. And we had, and after patients, when they walk in, they were a little skeptical. They say, "Oh, how are you going to take care of me if doctor is not there?" But after they finish the visit, they say, "Oh my goodness, this was very easy and very convenient." So it was very effective. We presented this paper at American Telemedicine Association in 2017. We got the first prize.
Wow.
For this. So can you accurately diagnose? Yes, there are many diseases that you can, but there are some diseases you can't. You have to have that thing in person. For example, if somebody fainted, or somebody broke his bone, or somebody has a severe pain in his abdomen which needs to be examined, you cannot do that remotely. But people who have cough and cold, the common symptoms, taking care of blood sugar, blood pressure, and other problem, believe it or not, Ashokji, 70% of chronic disease can be accurately diagnosed and managed by telemedicine. So that was your question number one. Number two, how villagers will look upon that? COVID-19 epidemic helped, because that was the only way for people to receive some care. And it required our 5,000 years mindset. We always believe that healthcare can only be given in person. Either doctor comes to the patient or patient goes to the doctor in clinic or hospital. But that was the only way we did it. Although we are forgetting that for past 100 years, we use telephone, care using phone. And now with technology, not only we hear, but we can see face to face, which added a functionality. We now have devices which can help us to measure blood pressure, pulse ox, temperature, and other biometric parameters. So it really adds a tremendous. And when we did this, we established 300 telemedicine centers in 300 villages. Mind you, what we do is we give a tablet or a cell phone, smartphone, along with devices, a printer, and some simple electrocardiographic recording, and a printer. We call it a telemedicine kit. It cost about $1,000. We trained a village resident, must be a village resident. We train him, and the program is in native language. So if it is in Maharashtra, it will be Marathi or Gujarati or Tamil. It is in 12 different languages. So he understands, very simple. It also has a built-in algorithmic way to analyze symptom. So if somebody says, "I have fever," then it will automatically, yes, no only, automatically say, when does the fever come? Do you get chills with it, etc. So each symptom, yes, no answer, it prepares a report for the doctor.
Wow.
And doctor can, so now doctor doesn't have to spend time to go through whole thing. He has the history, he can immediately, it really cuts down on his time and take care of the patient.
I'm so delighted to learn about all this wonderful work which is being undertaken by Wheels Global Foundation just in the last minute that we have. Yeah.
No, I have to say, and during this time, we provided free service to more than 15,000 patients in 7 states through these 300 centers. And my goal is to raise $10 million over next 3 years and create 10,000 sites. Each site can easily see 10 patients. That means I can see 100,000 patients a day, 25 million a year. And the cost is only one time because we are going to be collecting a small fee as operating cost. It's not going to be a complete free service. And it's my personal belief that free service are rarely valued by patients. So when you charge them, they demand quality, they demand service, they get the service, they value it, and they follow the direction. That's our goal. That's what we want to do.
Very noble goal, and visionary Dr. Raj Shah, cardiologist as well as chairperson for Health Council of Wheels Global Foundation, joining us and getting ready to go to India for 7th Ideal Village Conference on Sustainable Growth through Rural Transformation at Varanasi. Thank you very much for being a part of this conversation.
Ashok, thank you for this opportunity. I have to thank you, and I have to thank you, my good friend Sudhir Parikh, for making it possible. Hope we can take this message to
Wonderful.
All the people in India as well as here. Thank you again.
So thanks to him also, and thanks to all of you for being a part of this conversation. This is Ashok. Namaste.